students, in this video, I am going to talk about electrocardiogram. Just have a look at this image and recollect whatever you know about it. Most of you are able to identify P, Q, R, S, T waves, intervals, and segments. Some of the students, when they look into an ECG, can identify MI, axis deviations, hypertrophy, but they are unable to answer to questions like why P wave is a positive wave, why Q and S are negative, why there is isoelectric line, what is a segment, what is an interval, what is an electrode, what is a lead. Why I am saying is the whole purpose of this series of lectures on ECG is to start with the basics and then we move on to interpretation of ECG and have case discussions. There is no hurry. Slowly we master the ECG. Before I begin the class, did you ever come across these questions in your mind or from your teachers or friends? Okay, even if the answer is yes or no, now the questions are in front of you. Just pause the video, think for a while, come up with the answers. As soon as you continue to the class, I will be ready with the answers. Now, pause the video and think about it. There is no difference between ECG and EKG. Yes, it's just a spelling difference. ECG is an English word, whereas EKG is German word. Electrocardiograph. It is a machine that records electrical activity of heart. Electrocardiogram. It is a paper that we see filled with waves and lines. Because the paper is looking like a graph paper, don't think it as electrocardiograph. It is electrocardiogram only. Electrocardiography. It is the name of the procedure. Here is the image showing electrocardiogram, electrocardiograph and electrocardiography. Hope now you might have understood well. The purpose of ECG is to record the electrical activity of the heart. Now, what is the function of the heart? Here you no need to think, right? It's simple. Its function is to pump the blood. So, in order to pump the blood effectively, heart undergoes two actions. One is rapid activation, the other one is sequential activation. Rapid activation, it means all the myocardial cells of heart should contract rapidly at the same time. It's not like some myocardial cells will contract now and the remaining cells will contract after 5 minutes. Sequential activation means first the atria should contract, which fills the relaxed ventricles with good amount of blood. Suppose, what if both atria and ventricles are contracting at the same time? It's just like a fight between the two. There is no use. These two actions are under control of electrical conduction system in the heart, which is composed of conduction cells, also called specialized myocardial cells. Specialized myocardial cells act like electrical wires in the heart and spreads action potential to contractile myocardial cells so that the axial contraction of myocardium begins. Myocardial cells are of two types. One is specialized myocardial cells and the other one is contractile myocardial cells. Specialized myocardial cells are SA node, atrial cells, AV node, bundle of His, bundle branch, Purkinje cells, some ventricular myocardial cells. These cells, they initiate action potential but lacks contractile function. Contractile myocytes are responsible for myocardial contraction. Spread of action potential in these cells is with less speed compared to specialized cells. Cells that exhibit automaticity are pacemakers of heart. How many pacemakers does a heart has? All these conduction cells are pacemakers, but SA node has highest intrinsic rate of depolarization, that is 60 to 100 times per minute. That means At resting state, it generates heart rate of around 60 to 100 beats per minute. So, it is called as dominant pacemaker. Pattern of depolarization in conductive and contractile cells is different. It's a different topic and we'll discuss that in some other lectures. Here, I just give you a brief idea. SA node, when it discharges action potential, it spreads like a wavefront in water to surrounding atrial contractile cells. From there, wave of depolarization is carried to AV node and finally to ventricular contractile myocytes. Now the question is, those waves we see on ECG represents what? Is it depolarization of conduction cells or contractile cells or both of them? It represents contractile cells only. For example, at point A, SA node might have discharged action potential to result in atrial depolarization, but I am not seeing any wave at point A. There is isoelectric line only, but I see P wave representing atrial depolarization, that is, depolarization of atrial contractile myocytes. Why can't we record depolarization or repolarization of specialized cells? It is because conduction cells doesn't generate sufficient voltage to be recorded by electrodes. The current is generated somewhere in the heart, but how we are able to record it from surface of skin? See, there is abundance of ions in fluids and tissues surrounding the heart and in entire body. In that way, it is transmitted from heart to skin and recorded using electrodes which are placed on the surface of skin. What is an electrode? What is a lead? An electrode is a conductive pad placed on skin to record electrical activities of heart. Lead is a graphical description of electrical activity of heart by analyzing several electrodes. From 10 electrodes, 12 leads are formed. Of the 10 electrodes, 4 are placed on limbs, 6 are placed on chest. From 4 limb electrodes, 6 limb leads are formed. They are lead 1, lead 2, lead 3, AVL, AVF, AVR. From 6 chest electrodes, 6 chest leads are formed. Limb electrodes are placed on left and right wrist, left and right ankles. The electrode which is placed on right ankle, it is just to stabilize ECG, but it doesn't take part in any lead formation. Now coming to chest electrodes, V1 is placed in 4th intercostal space right to sternum. V2 is placed in 4th intercostal space left to sternum. V3 is placed in between V2 and V4. V4 is placed in 5th intercostal space mid-clavicular line. V5 is placed in 5th intercostal space anterior axillary line. V6 is placed in 5th intercostal space mid-axillary line. This is an image showing placement of 10 electrodes. Lead 1 records voltage difference between left and right arm electrodes. Left arm electrode acts as positive electrode and right arm one acts as negative electrode. Positive electrode is also called as exploring electrode. Negative electrode is also called as reference electrode. Lead 2. It records voltage difference between right arm and left leg with right arm electrode as negative and left foot electrode as positive. Lead 3. Between left leg and left arm. Left leg electrode is positive and left arm is negative 1. Left arm electrode in case of lead 1 it is positive, but in lead 3 it is negative. Now coming to augmented limb leads, they record voltage of corresponding extremity. For example, when AVF is being recorded, the electrode which is present on the left leg acts as positive electrode and the average of the remaining two negative electrodes is the reference point. Similarly, AVL and AVR. Here is a electrocardiogram with large squares and small squares. The large squares are with thick lines and the small squares are with thin lines. One large square has 5 small squares. The length and breadth of small square is 1 mm, whereas for large square it is 5 mm. The x-axis represents time, whereas y-axis represents voltage. Vertical axis 10 mm is equals to 1 millivolts, or 1 mm is equals to 0.1 millivolts. That means 10 small squares or 2 large squares is equals to 1 millivolts. The general speed of ECG paper, which you can find at the bottom of electrocardiogram, it is 25 mm per second. That means in 1 second the paper is traveling 25 mm. In 60 seconds it will travel 1500 mm. We know that 1 mm is equals to 1 small square. That means in 60 seconds 1500 small squares are traveled. 5 small squares is equals to 1 large square. So in 60 seconds 300 large squares are traveled. If 1500 mm is equals to 60 seconds, 1 mm or 1 small square is equals to 0.04 seconds. 5 mm or 1 large square is equals to 0.2 seconds. The terms unipolar and bipolar leads is no more used because all the 12 leads in ECG is bipolar. There are positive and negative terminals. This lecture is just an introduction to ECG. A lot more to say will continue forward. PDF link of this lecture is provided in the description.